Hello, I am Chris Messier, a student at the Bon Secours Memorial College of Nursing, and I am here today to talk to you about physical activity for healthcare professionals. So here's an agenda of what we are going to go over today. So we're going to discuss some general information, define PA in healthcare, go over the different levels of PA prevention, and then what exactly we can do with this information. So jumping right into our general information. All right, so physical activity and health. Why is this important to you? There are countless articles that speak to the benefits of physical activity and health. For instance, it is a cost effective intervention, meaning that it is inexpensive and sometimes even free for the patient. And has also been shown to both reduce the prevalence of disease and also improve the outcomes. For instance, in cardiovascular disease, there is an inverse relationship between physical activity and the disease state. The more physical activity an individual performs, the greater the reduction in risk. In diabetes, physical activity serves as both a preventative measure and an avenue to improve disease management. This also holds true for cancer. Overall, physical activity is a very crucial thing in promoting health and well-being, and it's a cost-effective intervention that can help reduce risk of various diseases and improve outcomes overall. So before we begin, we really need to define some key terms. So let's start with what exactly physical activity is, which is defined as any body movement produced by the contraction of skeletal muscle that increases energy expenditure above the basal level. So if you notice in that definition, I did not include the word exercise. So while all exercise is physical activity, not all physical activity is exercise. This is an important distinction to keep in mind. A metabolic equivalent task, also known as a MET, is a measure of energy expenditure. It represents the amount of oxygen that the body consumes based on the kilograms of body mass. So what this really means is that a body at rest burns one MET. So METs are normalized to one. A great example of like a big list of METs that are available to us is a Lippincott manual. They have a 15-page chart that just goes over all the various activities that somebody could perform, from washing your dishes, lifting weights, shoveling, riding a bike, sitting in church, just a wide variety of things. And it gives you all of the anticipated MET values of those tasks. So the next thing we have is moderate to vigorous physical activity, or MVPA. This is a term you're going to see a lot in the physical activity world, and it's used to describe the amount of physical activity that a person should complete weekly. Moderate activities are things that are 3 or more METs, whereas vigorous activities are things that are 6 or more METs. Physical activity is used to describe any individual that is not meeting MVPA guidelines. And lastly, we have sedentary behavior. This refers to activities that require less than 1.5 METs. So we're talking just above a body at rest. These activities are typically done while standing. So it could be something like washing the dishes, or even activities that we do while sitting in a chair. What are the recommended levels of physical activity? The Department of Health and Human Services publishes the physical activity guidelines for Americans, which define the recommended activity levels. According to those guidelines, adults should aim for 150 minutes of moderate intensity or 75 minutes of vigorous intensity, or they can do any combination of the two. You may have noticed that the recommendations for vigorous activities is 1/2 the duration of moderate activities. So what you can kind of take away from this is that for every minute of vigorous activity, you've essentially completed 2 minutes of moderate activities, and you can use that to achieve your goal of 150 minutes per week. Additionally, they really want you to try to get in 2 or more days of muscle strengthening. So where should we begin? So as we kind of highlighted in the last slide, the physical activity guidelines for Americans is owned by the Department of Health and Human Services. They provide a comprehensive guidebook that goes over all the various aspects of physical activities, which can also help you develop a greater understanding of what this program really represents. Another important thing that you need to take into consideration is the environment in which your patients live. Their surroundings can present both challenges and opportunities for engaging in physical activity. For example, are there usable sidewalks for walking or jogging? Are there bike lanes available for cycling? Are there public parks or other easily accessible locations where they can conduct physical activity? Understanding the physical environment really helps us tailor recommendations to support our patients in finding ways to engage in physical activity. Lastly, one of the major obstacles to physical activity is sedentary behavior. While we can't expect our patients to constantly be physically active at all times during the day, one of the key things we can do is try to reduce their sedentary behavior. Many of our professions involve us sitting at a computer now, so encouraging simple strategies like standing up during the day or while they're taking phone calls, or if they're going to be in a meeting, if they can walk during that meeting, all of these things really go out of their way to decrease the amount of sedentary time that we have each day. Now that we have defined the issues and provided some basic information, we can begin to focus on PA from a healthcare perspective. Primary care providers are one of the most seen providers by American patients, and this really places them in an opportune position to advocate for increased levels of physical activity. As an example of something that they can advocate for, or that any of us can advocate for, would be the inclusion of physical activity as a vital sign. This metric, much like the inclusion of pain, allows us to quantify, analyze, and develop interventions based on this data. This metric is very simple to gather. It consists of 2 questions, which might take upwards of 30 seconds to ask and receive the information with. And those questions are, how many days do you engage in moderate to vigorous physical activity? And how many minutes per day? Once we get that information, we simply multiply those 2 data points together, and that comes up with the amount of physical activity that the patient does per week. So building off that PA as a vital sign, we can then develop PA as a prescription. The American College of Sports Medicine, through their Exercise as Medicine initiative, has developed a prescription pad that can be used by any healthcare professional, which is, and you can see this on your screen. So studies have shown that prescribing physical activity has been an effective way to both engage and motivate our patients to improve their physical activity levels. For instance, if our PA vital sign shows us that our patient is only achieving 10 to 15 minutes of PA per week, we could develop a PA prescription to attempt to increase their PA by maybe 30 to 45 minutes more per week. It's really important that we understand we need to meet our patients where they are, and we need to develop smart goals with them. And then we need to prescribe this PA prescription in accordance with those goals. We don't want to just blanket prescribe 150 minutes to everybody, because that's not going to be realistic or feasible for most people. So with that, how do we go about engaging our patients to really help them understand the importance of physical activity? Peer-reviewed process that has been found to be effective is something known as motivational interviewing. So motivational interviewing centers around guiding the patient to find their own solution. Going over the template that you can see on your screen, if we can maintain a level of patient autonomy, remain empathetic through their plight of why they're not getting enough physical activity, and we can really kind of guide our patients to identify their own solutions to increase their physical activity levels. This approach really avoids any pitfalls of us advising or recommending interventions, and instead it really fosters a sense of buy-in from the patient. So next up, we're going to look at the various levels of PA intervention preventions. So these are going to look very similar to our healthcare levels of prevention. So first up, we have primary prevention. This kind of focuses on disease prevention. So for our elderly populations, this might be something that increases their movements or their strength. Studies such as the Seattle Fix-It and Move It research have shown that there is a dose-related response in both aerobic and strength conditioning. As the complexities of these movements increase, such as going from a stationary bike to walking, or walking to an aerobics class, there was a greater reduction in risk of falls and the length of hospital stays related to any falls they might have had. As mentioned earlier in this presentation, Physical activity is a very low cost and effective way of reducing the prevalence of disease. So, by utilizing health screening tools such as physical activity as a vital sign, we can really focus on finding interventions to prevent disease states. Next up, we have our secondary prevention. This is aimed to address chronic diseases that patients already have, and it's really meant to reduce the detrimental effects of those diseases. So here again, the American College of Sports Medicine, through their Exercise is Medicine initiative, the ones who developed that PA prescription, they also have multiple plans designed to specifically target chronic diseases and mitigate a lot of their effects through physical activity. Physical activity has been shown to have significant benefits for cancer patients, including mainly the reduction of treatment side effects, decreased overall healthcare costs, and fewer absences from work due to those treatments. These outcomes really highlight the positive impact that physical activity has on addressing the holistic nature of our patients. So, by incorporating physical activity into management of chronic diseases, we can both improve patient outcomes and enhance their overall well being. And finally, we have tertiary prevention. So, one of the best known examples that most of us are probably familiar with is cardiac rehabilitation. So, after a patient experiences a severe cardiac event, most of the time they're prescribed cardiac rehabilitation afterwards. These interventions aim to minimize the impacts that that event had on the patient, and it helps them return to some normalized level of functioning. It's important to note that at this level, these interventions are closely supervised by an interprofessional team that is dedicated to making sure that we have a safe application of physical activity. This collaborative approach is really designed to tailor PA programs to meet the needs of the patient while optimizing their long-term recovery goals. So now what do we do with all this information? So one of the main limiting factors in utilizing physical activity as a health intervention is the lack of involvement. And this often stems just from a lack of knowledge about physical activity itself. So I really encourage each of you to go out and educate yourself on the importance of physical activity, the consequences of inactivity and sedentary behavior, and what it truly means to achieve those 150 MVPA minutes each week. Furthermore, I encourage all of you to develop that understanding of your local environment. Identify any shortcomings or barriers to physical activity, and that where you live and where your patients live. Take an initiative to petition your local representative to help them understand the importance of physical activity and to allocate resources to address those gaps. Advocate for inclusion of physical activity as a vital sign within your hospital system. This data is crucial for us to understand the overall health of our patients and design comprehensive care plans. Consider joining or establishing a local coalition focused on promoting physical activity. Engage with licensed licensed exercise physiologists, professionals who this is what they do for a living, is develop exercise plans. Recognize that sedentary behavior is often associated with our work environment. So collaborating with local businesses to develop strategies that can encourage movement at work and thereby reducing sedentary behavior. You can go out of your way to demonstrate the positive impacts of physical activity on both their employees' health and productivity. And that really might help both business leaders and policymakers, such as politicians, get involved in this. Reach out to your local, state, and national parks to explore opportunities for collaborations. Many parks offer programs such as the National Park Prescription. This is where the national parks offer free or low-cost guided walking tours to individuals that have been prescribed national parks as a prescription. So in this situation, there's a national parks tour guide that will take you around the park, getting you some exercise in through walking. And exercise probably wasn't the best choice of words there, because remember, physical activity is not exercise. Exercise is physical activity, though. There's just so many different ways to really get involved. So I hope this really helped develop a sense of further understanding of physical activity. And I look forward to engaging with all of you and with our patients to really make this a bigger part of their lives. Thank you for listening.